Okay, well, welcome everybody to our third webinar of this academic year. My name, for those of you perhaps who haven't met me, is Joan Roberts, and I'm manager of the School Health Research Network. And we're delighted to see some names of people who've joined us that we haven't joined us before. So welcome. We have, just for your information, a mixture of our network school representatives. We also have some healthy school staff and National Quality Award verifiers and some people from the Children's Commissioner office. So as I say, welcome. Just a quick resume. If you've not joined a webinar before, you might be finding it all a bit confusing. You can see us, but we can't see you. I'll just take you a little guide around the screen. So the bottom left of the screen is where you can choose if you'd like to type any questions. You can do this at any point during the webinar, and then I will pick up on that if it seems appropriate. We've had a few hellos there, and you can actually direct your questions either to everyone or just to the presenters. And we have Mike in the room, and if you have any technical questions, you can type to either of those groups, and he can pick that up and act on it. At the moment, so you can type at all right the way through the presentation, but in the microphones will open right at the end, and you'll know that the microphones are open because the line will disappear from the mic right at the top of the screen. And you can speak if you've got a microphone in your laptop or whichever machine you're joining us on. Just one other thing, as soon as when the webinar closes, and we promise we'll finish by 4:30, there will be a very quick evaluation that will flash up, and it would be useful for us if you could fill that out. And also we will have a research brief, so a very easy to read, easy to digest, 2 sides of A4, just a resume of what Sarah's been saying. So without any more ado, I'd like to introduce my colleague, Sarah Long, who is going to present. It's an interesting area for us in the network, to looking at some research she's done on looked after young people. So welcome, Sarah.
Thank you, Joan.
And look forward to hearing what you have to say.
Thank you, Joan, and thanks everyone for joining. We've got some really interesting stuff coming up, and I hope you find it as interesting as we have. Okay, so the main thing that I'm going to be talking about today are substance use, wellbeing and relationship outcomes among children in foster care compared to children from private households. But before I go into that, I'm just going to give you a little bit of background about myself, and also about the School Health Research Network. So I know that a lot of you are familiar with the School Health Research Network, but there are some new members, so I thought it would be useful to just give a little bit of background as well. Mm-hmm. So I'm a researcher, and I'm based in Decipher, which is a centre for the development and evaluation of public health interventions. And the School Health Research Network sits within Decipher. But I also do some work at the Children's Social Care Research and Development Centre as well. So this is Cascade. So my work essentially cuts across these 2 research centres. And like I said, I'm just going to give you a little bit of a background really about churn and about how this study came about. So so the School Health Research Network is a partnership between the schools in the network, obviously, Welsh Government, Public Health Wales, ourselves at Cardiff University and Cancer Research UK. And the aims of the network essentially to improve young people's health and well-being by collecting and sharing health and well-being data, which the schools have provided, supporting new research into school health, and by also facilitating evidence-informed practice. And as you're aware, the School Health Research Network involves both staff and student level surveys on various health and well-being outcomes, and I'll go into that in a little bit more detail in a moment. And the 2015 survey involved we had representation from over half of all secondary schools in Wales, and because of Joan's amazing work, the numbers are increasing steadily. So the 2017 survey will have larger numbers of schools and pupils. But the 2015 survey had a sample of around 35,000 children and young people. So this is really quite a large sample, especially to do sort of studies on smaller groups such as children in care. And I'll go into that in a little bit more detail in a moment. But just a recap on the health and wellbeing issues that are included in the student level survey. So the School Health Research Network data now is at a stage where it can be used to identify population level issues. But in relation to sort of subgroup analysis, what's captured in the Student Health and Wellbeing Survey is really, really useful. So for example, we captured demographic variables, so things such as age, gender, and also living arrangements. So, you know, who the child lives with, whether that's a parent, both parents, single parent or foster parents, and that's what's enabled us to do the analysis of foster care children. But we also look at sort of lifestyle behaviours such as nutrition and physical activity, sexual health and sexual activity, and dating and relationship violence. So we can do subgroups not just based on sort of demographic factors such as who the child lives with or their gender or ethnicity, but we can actually look at sort of high risk behaviours and think about doing analyses of children who are at risk of facing particular issues. So that's the Student Health and Wellbeing Survey. Obviously, we also collect data from senior management teams within the schools. So we're looking at things ranging from physical health and mental health in the curriculum, right down to sort of overall embeddedness of health in the school curriculum. So we're looking at a wide range of sort of policy and practice things that are happening on the school level as well. And I thought I'd give you a couple of case studies of the sorts of subgroup analysis that we've been doing before going into describing the specific foster care paper that we've done. So, as an example, a piece of research that I've just been working on is looking at the association between school level health policy and practice. So, thinking about the school environment questionnaire that I just showed. Thinking about linking that with education outcome data at Key Stage 3 and Key Stage 4. So we've got this freely available data from a website, essentially. It's sort of school level attainment data, and we're looking at inequalities in education outcomes, that, you know, the extent to which that varies by the school level policy and practice, health policy and practice. And we've been particularly looking at high and low FSM schools to see if there's a difference. So that's an example of how we can do subgroup analysis on the school level. We've also been doing a bit of research looking at sexual health policy and practice on the school level, and thinking about how that's associated with various sexual health behaviours, including risky sexual health behaviours. And then finally, which is what I'm going to talk about in a little bit more detail, we've been looking at substance use, wellbeing and relationship outcomes among children in foster care and children from private households. So we've just had this paper published in an academic journal called the British Medical Journal. So yeah, I'll just tell you a little bit more about that.
There's some useful, interesting things coming up then, which we'll be sharing probably in webinars sort of next academic year. So thanks for giving us a nod on that. Okay, so in this particular analysis that we did with foster care children, the measures that we used from the survey were the substance misuse measures, the wellbeing variable, and also the care variable that I mentioned, which essentially is asking students about who they live with, whether that's their mother, father, or foster parents. We're currently going through a process of reviewing measures at the moment, including the sort of living arrangements variable, and I'll say a little bit more about that later on. But essentially, from the 2015 survey, we were sort of limited to looking at children in foster care. And we also looked at relationship outcomes, so relationships with teachers, peers, romantic partners, and experiences of
either bullying or actually experiencing bullying, so both ends, so committing bullying as well as receiving it, if you like, for want of a better description. And here is just a quick example of a relationship variable that we looked at. So we were looking at relationships with teachers, and there were a few questions around this. But one of the questions, for example, was, I feel that my teachers care about me as a person. And then the student indicated whether they strongly agreed, right down to strongly disagreeing. Or they could say that they didn't want to answer. And I'm just going to say a little bit about the background and context of the study, essentially. So, looked after children and young people is a Welsh Government priority, and reducing the numbers of people in care is also a priority. But with regard to the figures, the figures are that there are 1.8% of children in Wales in care, in local authority care, and this equates to just over 5,500 children. Which is 50% higher than the English prevalence. So when you look at the percentages, it doesn't actually look like that much. In England, there are 1.2, in Wales, there are 1.8, but actually that is a 50% higher proportion in Wales. Mm-hmm. And 3/4 of those children are in foster care. And we know that looked after children and young people have much poorer health, social and education outcomes. But there is, however, a lack of large-scale quantitative studies in Wales, but in the UK and elsewhere in the world as well. So this study was really, really useful and is a really good demonstration of how the School Health Research Network data is being used for subgroup analysis, because this is actually one of the largest samples in the UK with regard to the studies that are already available. So this paper that we've just had published has actually been really well received. So we analysed the data, and I won't go into too much detail about the statistical methods that we use, but essentially we calculated the risk or the odds of having various outcomes among children in care compared to children from private households. Okay, so we ended up with almost 300 children who were in foster care and 28,500 children from private households. And what this graph shows essentially is like I said, the risk and odds of having outcomes. So the bars in black are the children in foster care, and the bars in grey are children from private households. And as you can see, the risk and odds are much, much higher among children in foster care. So, for example, smoking and cannabis use was around 5 times higher, binge drinking almost 3 times higher, methadone use, which was formerly a legal high, but obviously they've changed the terminology for that now. That was almost 10 times as high among children in foster care. And children in foster care also had much poorer well-being. So we also examined relationship outcomes, as I mentioned, and again, the black bars show children in foster care, and we can see that children in foster care were almost twice as likely to have poorer relationships across the board. So with teachers, friends, also experiencing bullying and experiencing dating violence. Okay, so how can we sort of explain these worse outcomes among children in care? Well, we know that there are certain care-related factors that play a role in sort of perpetuating bad outcomes or creating bad outcomes. And we know that placement type is an influential factor. Obviously, as I mentioned in this study, we were limited to looking at children in foster care, but actually we know that different placement types, such as residential care, can contribute to worse outcomes as well. Things like placement stability contribute to poor outcomes. So the length of time that the child's in the placement, and the number of placements as well, the number of times the child's moved. So all of these things can contribute to better or worse outcomes. And there are also pre-care factors that relate to the child, so things such as disability or mental health issues, parental factors such as learning difficulties, coming from a single-parent household, mental illness and substance misuse. But importantly, histories of maltreatment are really strong predictors of entry into care. And the fact that consistently poor outcomes are observed across international contexts, so not just in Wales, and this is despite sort of differences in care systems, this kind of suggests that pre-care factors do play a significant role. And so the histories of maltreatment and neglect have also been linked to sort of poorer social and emotional development. And so we see things such as attachment disorders, unstable relationships with primary caregivers, which can then spill over into unstable relationships with others as well at school or in different settings. And essentially, this is kind of due to sort of disruption with the primary caregiver, and sort of that's the result of maltreatment and neglect. So we know that early maltreatment and neglect is harmful. So we began thinking about the fact that, the fact that we were seeing these poor relationships, and this is really important because actually there's a lot of evidence to suggest that healthy social relationships are health protective, and conversely, having poor relationships is health damaging. And this is something that isn't just limited to children. This is something that's observed across the life course. So, for example, we know that loneliness and social isolation during old age is a major contributor to sort of illness and early death as well. There's a lot of evidence around this. So we began thinking about how the relationships could actually sort of influence the association between being in care and having substance misuse and poor wellbeing outcomes. So essentially what we were thinking is that the relationships could actually sort of serve to improve outcomes among children in care. And I think I'll just go on to the next slide because I created a diagram and it's much easier to explain when there's a diagram. So this is what we did with the first analysis. The results are in the graph that I just showed you. So essentially we're looking at children in care, children not in care, and then looking at substance use, wellbeing and relationship outcomes. But we decided in the second set of analysis, given the evidence that I've just mentioned on the protective role of relationships, we decided to account for relationships as mediators. So this time, this is kind of what we did. This is a statistical model. I don't know if I've captured the complexity by adding a big box in the middle, but essentially,
makes it clearer for us.
So we were looking at the extent to which the relationships either made the association between being in care and having worse outcomes, or having outcomes worse or better. So I'm just going to show you now the results of this analysis. So this time, the bars on the graph show they're all for children in foster care, but the blue or grey bars are before we accounted for the mediating role of relationships, and the black bars are after. And what we can see is a consistent reduction in the association between being in care and having various outcomes. And okay, the children in care still have poor outcomes, but actually this is really, really important because it's suggesting that the relationships have the potential to be health protective. And so this is observed across smoking, cannabis use, binge drinking and poor wellbeing as well.
I think that seems really, as a teacher, I've been a teacher in my life, that so the relationships they build up in schools can sort of be as supportive as well as the ones they build up with their foster carers.
Yeah, exactly. I mean, obviously in this study we're kind of limited to the fact that the relationships we were looking at were with teachers, peers at school, and also dating and relationship violence and kind of experiences of bullying. So we didn't, at this stage, we haven't looked at relationships with primary caregivers.
Okay.
Which, I mean, if we'd included relationships with primary caregivers, we might have seen greater reductions. We don't know yet. That's potentially an avenue to explore further later down the line. So just thinking about this, and I've kind of touched on this already, but we know that, just to recap, we know that exposure to sort of adversity in childhood, such as maltreatment and neglect, is associated with poor outcomes. And we also know that this can impact on relationships through sort of disruptions to, essentially, without going into too much kind of biological detail, there are the studies out there to show that sort of chronic fear associated with maltreatment and neglect can cause like changes to the child's body and brain, if you like, which can have lasting impacts on brain development. And so we kind of think this is a potential mechanism by which we see the faulty relationships and the poorer outcomes. So we know that this adversity impacts on relationships and also impacts on outcomes, but it's kind of positive that we're finding that if the child has healthy relationships, this can kind of be health protective. And we also know that there are other factors that are not to do with the child. So being in care is associated with sort of stigma, and sometimes due to sort of social processes, these groups can become marginalised from society. So that's another mechanism through which we might see poorer relationships at school. So essentially, we need to be thinking about not just sort of helping the child to form better attachments, healthier attachments, but also thinking about the role that the schools can play in having a sort of inclusive culture for children who might otherwise be marginalised from social groups. And I'm just going to talk a little bit about a couple of next steps.
It'll be really interesting.
Yeah. So I think the survey is absolutely fantastic and it's really valuable. As I mentioned earlier, we've just been through a process of sort of reviewing the survey measures from the 2015 round. And some of the things that we're thinking about is, for example, how can we make the care variable more sensitive? Like I mentioned, at the moment, from the 2015 data, we're only able to look at children who were in foster care, but something that we're planning is sort of picking up on different types of care. So we might be thinking about residential and kinship care. The factors that are sort of known to influence outcomes as well that I also mentioned earlier are around sort of the number of placements and placement stability. So we're also thinking about how we can capture these things as well in the Shern survey. We're also reviewing other measures. So we've been thinking about the wellbeing measures and the relationship measures as well. Like I said, we've just looked at sort of relationships with teachers, peers, and romantic partners. But I think it's really essential that we're picking up on relationships with caregivers, whether that's the mother, the father, or the foster parents, and so on. And I think that is really important to start thinking about how we can sort of promote healthy and positive relationships among not just children in foster care, but among all children, because there is a massive evidence base around the sort of health protective role of relationships in relation to health outcomes, but also well-being outcomes and mental health. So if you can really foster that culture of sort of inclusion and that culture of having these healthy relationships that places a lot of value on having healthy relationships, I think that really makes a big difference to not just the classroom environment, but the school environment and beyond. So we're thinking about essentially the implications of our findings for policy and practice, and we've kind of started linking in with policy and practice partners already, thinking about the next steps in terms of possible interventions. We haven't got very far yet, but we've been thinking about it. So essentially we're just thinking about how do we develop this further and how can we think about including or promoting positive and healthy relationships in schools. And I think that's it.
Yeah. Oh well, that's been really interesting, and I hope you all feel the same. It'd be interesting if any of you wanted to make any comments. I mean, I think some of you, it looked like you were very much involved with, looked after young people in the schools. So if you had any queries, thoughts, it would be great for you to either type that or to speak about it. I think I would just like to add that by schools actually doing the survey with their young people, and the next round will be in autumn 2017, but just the use, the value of that to Wales and beyond. You were saying both in the UK and beyond. Then this is a very large sort of group of young people. Large base of young people's data to be able to use. So as a sort of thank you to the schools, but also an encouragement for 2017. And we have a question which I'll just ask of Sarah, really.
Just adding to that, though, I mean, the value of this survey is just incredible. I mean, there are no other countries that have got a national survey of this scale, and we're ahead of the game in Wales. We really are setting the bar quite high with this. So thanks so much to all the schools that are involved in this and their continued efforts to sort of make this happen.
Yes, because it is the size that allows you to look at small groups,
exactly.
Like looked after young people. So it has sort of huge potential, doesn't it?
Exactly.
So we've got one question about that Gillian has very kindly typed for us. But do the schools listening think they could use this research in their own schools, and how might that influence any practice? I was particularly taken with the fact that Sarah was saying about the protective relationships in schools, both with staff and with between young people and between staff and young people. But is there anything that anyone else has picked up on, really, that they feel that they could use this within their school? And then Gillian goes on to say, would they be interested then, because you're looking at next steps, but would any of you be interested in involving their students, including those in care, in this research going forward? And I guess in terms of staff as well, it's the involvement of different people in the school, if it's if it's that. So if you feel that is the case, if you wanted to contribute here, but if you sort of feel shy to do that, then I'm sorry, I'm assuming that you would be very interested to hear from you. So the way round that would be to contact either me direct, Joan Roberts, or just use the Shern email address, and then we can is the mic locked? Yes.
All attendees are muted and may unmute themselves by pressing *6.
Oh, there we are. So the microphones are open if you wanted to talk and to ask questions. But as I say, otherwise, when you've had perhaps time to digest what it is that Sarah's been saying, then you can get in touch, and maybe that's the sort of next stage forward.
I mean, it'd be fantastic if we did hear from any of you in terms of how this research might be used in practice, but also if we'd be really keen to sort of co-produce any further work that we do with the schools, with the teachers and the senior management team, but also with the children. So please do get in touch if you have any ideas about how we could do this going forward.
Yeah, and I think perhaps just to sort of on the back of that to say, that's really why the sort of network was set up, to be able to do that sort of thing. It's a joining together of schools, researchers and policymakers. And Kate's very kindly written something. So the research could be very useful as looked after young people continue to be a focus with regard to wellbeing and progress. So that sounds so obviously in Kate's school that is the case, and I think probably that is echoed nationally, isn't it, in terms of wanting to look at that. So so it seems it's like it just opened up a new area, hasn't it? And I think that's the network's been very good at doing that and looking at different sort of health issues. But this is probably the first one where we've really focused into a smaller minority group, and I think it has real potential, doesn't it, to move from there. So what I think we'll probably do is, if I continue, and I'll just give a little bit of network news, but if there's anything that you wanted, perhaps I should stop talking for a minute just in case anybody wants to ask a question through the microphone, although we would, I'm just looking at Mike, we'd be able to tell if somebody wanted to speak, would we? Would that be clear from, I'm just asking Mike if...
just to recap, if you did want to switch your microphone on, I think you press F6, right? Or the microphone button at the top.
Or the microphone button at the top. Yeah.
I'll be available for the next 15 minutes, so feel free, fire away.
I know it is. We know it's sometimes a bit daunting to be the one who might do that, but I can just sort of go and perhaps sort of continue with a bit of network news. But you know, if something comes into your mind, then do either type it, or I can stop talking at any moment if anybody wanted to say anything else. So just some little reminders. It's a good opportunity just to catch up with everybody through a webinar. Oh, I'm very sorry. This is your lovely last slide.
I thought this would be a nice slide to end on, but yes. I forgot about it. So I hope you all really enjoy it. It's a really nice one, I think.
It is. I can see that.
We don't have to dwell on it for too long, Joan. We can move on.
Right, okay. So just as I say, just a little bit of news. All right, so we do have a question from someone saying how many schools in Bridgend are involved in the survey. Well, one of my slides that I'm going to go to in a moment is about recruitment. We're in the middle of recruitment at the moment. So we're opening out recruitment to all secondary and middle schools. So that's mainstream schools with young people from 3 right up to 18. We're opening out recruitment to all of the schools. So the schools we have at the moment, we have I think over half of that authority, and we have I think 9 complete authorities, and a lot where there's only 1 or 2 schools still left to recruit. I think we're up to about 160 schools have joined the network so far, but there's a lot that we're in discussions with. So so if you feel that you know people you're in other schools that you'd like to share the value of working in the network, then we'd love to we welcome you to join us. So so as I say, that's till the end of May, but the sooner anybody wants to get in touch with any of us, we'd be delighted to hear about it, and we'll certainly follow it up, and I can come and visit. And we're working where the recruitment is being supported fantastically by a Healthy Schools scheme, and I'm travelling around Wales to try and to move forward on that. The survey is there are basic questions that are the same. Got a question there about the survey. There are basic questions that are the same because they're from the Health Behaviour School-Aged Children Survey, which is an international survey. As Sarah said, we've been looking at there's a sort of process of tweaking some of the questions. Schools also, when we meet you in the summer, that is a question that we're going to ask to make sure that we're asking questions on your health priorities. And to avoid disappointment about not being involved in that, so for schools we will be running 3 network events in the summer. For the last 2 years we've run just 2, one in the south and one in the north, but because we're opening out recruitment and could potentially have all 200 plus secondary schools in Wales, we're going to be running one in the National Botanic Gardens in Carmarthenshire, and that's on Tuesday the 13th of June, the Millennium Centre in Cardiff, and the Key Hotel in Deganway up near Llandudno. So, do come to that, and we can make sure that your views are considered. So, so thank you, Cheryl. I've just noticed that you've managed to give the answer to the question in the authority in the question. So, so as I say, that's one little reminder. We will be sending out a newsletter next week, and that is where you will be able to register to join our summer event. It's at no cost, and we can pay for travel expenses, but all that information will come in the next newsletter. So just let's have a look. Just moving on. Yeah, so just, yes, to say that'll come in the newsletter. It is fantastic to all meet up, and it is a time for you to be able to network with other schools. We have Healthy Schools staff will be there as well, and the team, so me, Gillian and Cheryl, and we will have some researchers with us who have been working on the data for the network. And I know that the highlight for schools is that to hear about other schools and how they're using their student health and wellbeing reports. So, it'd be lovely if you'd like to volunteer to do that this time. So I think that's, it's a really positive sort of day. And as just to repeat, really, because I mentioned recruitment's open at the moment. If you want to pass on any information about the network and how valuable it is, then that would be great, and we'd welcome all schools to be part of it. And then just a little reminder again, for those of you, the next round of the survey, so that's the student survey, will be the autumn. It's open. It's an electronic survey that is open from September to December. Schools can organise it as they want. There's no cost to the school, and the school, to make sure that they've got the most rigorous data, they can involve all of their students. And then we will be feeding the survey back, so you'll get your report back by Easter, because schools have said that's when it's good to be able to fit it into the school development plan, so for actions to be put in place. And those of you who were able to have who were part of the network in 2015-16, you'll get a chance really to evaluate some of the actions you've put in place since then. So it'll be an exciting time to do that. So I'm looking at the clock, and we have another 5 minutes or so if anybody has a chance. The survey on the website. Sorry, that's a question. The survey changes slightly every year. So what we do is the actual survey itself, I don't think is on the website, but if you feel that it'd be useful for you to see the last round, but that's not to say it's going to be exactly the same as this round, because as I say, we can be reactive to network partners in terms of what they need to see in there. But if you'd like one, then please do get in touch with us. So I think if that's everything, please get in touch with Sarah, because I think she'd be interested to hear your views. And when we close in a moment, there'll be a little evaluation sheet will pop up, and that will be great. And then we will also be sending you out a resume of Sarah's research. And as I say, just be in touch, and we look forward to hearing from you. But thank you for joining us. And
just to add to Rachel Morris, you asked how many schools were in the network in Bridgend, and there were 6 secondary schools. Sorry you had to wait so long for that answer.
Sorry. Okay.
Thank
you.
Thank you very much.